My next speaker is Dr. Valerie Gouon-Evans. Dr. Gouon-Evans is an associate professor of medicine. She's in the Center for Regenerative Medicine, and she directs our BULB, BU Liver Biology program. She's also the co-director of our largest PhD granting program on the medical campus, the graduate program in molecular and translational medicine. She has a remarkable career advancing IPS-related liver regeneration research and is the outstanding researcher of Boston Medical Center this year. And so I'm delighted to introduce Dr. Gouon-Evans.
Thank you, Darren. Right, so I'm very grateful for this wonderful opportunity to present my lab works today on mRNA nanomedicine to treat the liver disease. And this is an important topic because of the rising prevalence of the liver disease in the USA. So indeed, 6 to 8 million patients suffer from chronic liver disease here in this country. And based on the underlying cause of the disease, up to 46% of the American population develops a non-alcoholic fatty liver disease, a fatty liver, that can then progress to liver fibrosis, cirrhosis, and cancer ultimately. And the current treatment for the liver disease really focus on eliminating the underlying cause. So far, there is only one drug that has been approved by FDA to treat the chronic liver disease. But really, liver transplantation remains only treatment for end-stage liver disease. So there is an urgent need for alternative therapy to prevent the progression of the disease and revert it. So to address this clinical gap, my lab developed strategy to harness liver regeneration. And this is by promoting the naturally occurring liver repair mechanism. And this will allow generation of hepatocytes, which are the most functional cells in the liver. So the liver is known for its fascinating ability to regenerate. And the first and most efficient way to do that is simply by proliferation of mature hepatocyte, so hepatocyte-driven liver repair. But in case of acute or severe, acute or chronic injury, this mechanism is compromised. And the cholangiocyte-driven liver repair mechanism can take over. And in this scenario, the cholangiocytes, the cells that line up the bile duct in the liver, are believed to be a source of liver progenitor cells. And as such, they proliferate and they can differentiate into hepatocyte. And the third mechanism is cell therapy. So cell therapy using primary human hepatocyte or patient-specific induced pluripotent stem cell-derived hepatocyte and endothelial cells is also a strategy that we are investigating. So for this mechanism to become a potential therapy, they need to be harnessed. So to do so, we decided to activate this mechanism by using hepatocyte, very well-known hepatocyte regenerative factors that we delivered into the liver with nucleoside-modified mRNA encapsulated into lipid nanoparticles. So the nucleoside-modified mRNA are in vitro transcribed mRNA, and they harbor modifications that have been pioneered by the Nobel laureate Katalin Karikó and also BU alumni Drew Weissman. So this modification prevent immunogenicity and increase mRNA stability and the translation into protein. They have many advantages. They are clinically safe as they do not integrate into the genome. and they have been widely used with mRNA-based COVID-19 vaccine. Once they are complex with lipid nanoparticles, they can specifically target the liver, which is very convenient for us. And they allow control expression of protein with time. And for example, they will be expressed no more than a week, which is also very convenient when we want to overexpress mitogen. So we first injected mice with luciferase mRNA LNP to validate the liver specificity of mRNA transfection. And here we can look at it by the luciferase bioluminescence activity that is specifically in the liver on the left. And we can see also that the expression of the bioluminescence, activity of the bioluminescence lasts only 3 days, which was expected, and it's what we want. We can control expression this way. And to identify the cells in the liver that are transfected by mRNA, we injected the mice with enhanced green fluorescence protein, mRNA LNP, and we found that virtually all hepatocytes are transfected, and along with 70% of endothelial cells, 40% of Kupffer cells that are the macrophage of the liver, and the cholangiocytes were not transfected. So once we establish this platform, we then use it to try to alleviate liver disease in mouse model. So here I'm going to show you 2 examples. And the first one is from Anna Smith, a PhD student in the lab who graduated recently. So she showed that the hepatocyte mitogen AGF and EGF mRNA LNP can improve drastically engraftment of primary human hepatocyte. That was done in the liver of an alpha-1 antitrypsin deficiency associated liver disease mouse model, the PiZ-NSG mice. So in this mice, we can see an accumulation of the mutated Z80 that polymerize in the cytoplasm of the hepatocyte, and it's exactly what we see in the human disease. So what Anna injected in addition AAV P21 in this mice, and this really was to mimic the hepatocyte senescence induced by P21 that we also observe in patients. Then she transplanted 1 million primary human hepatocyte, and she injected the mice twice a week for 5 weeks with AGF and EGF mRNA LNP. And this was to stimulate the transplanted cells, to stimulate the survival and proliferation of transplanted cells. So this is what she found, that AGF and EGF mRNA LNP led to robust and sustained engraftment of functional primary human hepatocyte. So as you can see on the left, the steady increase of human serum albumin with time, and these are indicative of the engrafted cells in the liver. And you can see that by that time, 30% of the liver was repopulated with the human cells, and you can see them in pink with this staining for human cells, human nuclei. So globally, so what we concluded is that AGF and EGF can really promote drastically engraftment of the cells, and also actually can reduce the liver disease burden. So you can see here the decrease of the polymer in the cytoplasm of hepatocyte indicated in dark purple, also a decrease of the circulating serum Z80 with a blue column, and a decrease of the liver damage with decreased level of ALT. So this was the first example, and the second example is the use of, this is a project from a postdoc in the lab, Fatima Rizvi. She used VEGF-A mRNA LNP, and that was to promote cholangiocyte to hepatocyte conversion. in vivo in mice. And also she could reverse the chronic liver disease. So the rationale for using VEGF-A is that it is a ligand of VEGF receptor 2, or KDR, the receptor. We previously identified an hepatic progenitor, and that was done in an in vitro culture from human and macaque pluripotent stem cell differentiation culture into hepatocyte. And we found that when we inhibited KDR in this culture, we decreased the ability of this progenitor to become hepatocyte, suggesting that activation of KDR can promote hepatic differentiation. We also identify these progenitor cells very early in the fetal liver, and we found with the lineage tracing that they can give rise to adult hepatocyte. So this finding led us to speculate that the regenerative liver in adult can use the same cues as a developing liver. And Fatima asked 2 questions. So is KDR expressed on cholangiocyte, which are the source of progenitor cells, following liver injury? The answer is yes. And can we use VEGF-A now to activate the cholangiocyte to differentiate into hepatocyte and rescue liver function? So to address this question, Fatima used a chronic liver injury that was induced with a diet called deficient methionine supplemented diet. And this developed steatosis and fibrosis. She then injected mice with AVP21 to mimic hepatocyte senescence that is seen in all liver disease. And she delivered VEGF-A with mRNA LNP. So she followed the fate of cholangiocyte into hepatocyte by using this mouse model, this inducible Cre reporter mice. So in this mice, upon tamoxifen injection, the cholangiocyte become tomato positive, as well as hepatocytes that are generated from them. So now in the following slide, we're going to look at the tomato positive hepatocyte. They will be coming from cholangiocyte. This is a result of the chronic liver injury after 2 injections of VEGF-A. You can see on the left in control injected mice, so in the absence of VEGF-A, most of the red cells are cholangiocyte, very small red cells, and we can see a few diffuse patches of tomato-positive hepatocyte. In contrast, in presence of VEGF-A, you can see that VEGF-A drastically differentiates the cholangiocyte into hepatocyte, into this large cluster of tomato-positive hepatocyte. And that was very significant with a 5-fold increase. In addition, what we found is that VEGF-A can completely revert steatosis. As you can see on the right, steatosis was still seen in green in the control treated mice. We could also completely revert fibrosis, which was still seen in blue in these mice. So here we wanted to know now, could we use actually VEGF-A by LNP to treat the liver disease in human? So we then look for KDR expression on cholangiocyte in advanced human serotype specimen. And here, to our great surprise, we can see on the left, you can see at the margin of the regenerative nodule, some cholangiocyte you can see in the frame 4, and we identify the cholangiocyte with KRT7. So you look on the right now in the middle, and this cholangiocyte express KDR also. And we can even see now, looking at the middle panel, some intermediate hepatocytes that are budding from this string of cholangiocytes that express also KDR. And on the left, we see cluster of hepatocytes expressing KDR. So the presence of KDR on cholangiocyte suggested that VEGF-A mRNA LNP could serve as a therapy to potentialize cholangiocyte-driven liver regeneration in this advanced liver disease. So this is my conclusion slide. So I hope I convince you that mRNA LNP is a potent tool, actually could be a potent tool to treat the liver disease. I didn't have time to show you, but on number 1, we showed previously that AGF and EGF can promote hepatocyte proliferation and can promote hepatocyte-driven liver repair. Today, I showed you that VEGF-A can harness cholangiocyte-driven liver repair and decrease actually at the same time steatosis and fibrosis. And finally, I showed you that AGF and EGF can promote cell therapy with a primary human hepatocyte. So hopefully what we hope is that this platform can help alleviate acute and chronic liver disease, and especially acetamine overdose or the fatty liver or fibrotic liver disease, and also some genetic liver disease. I would like to acknowledge my whole lab who really work together as a team to establish the mRNA LNP as a platform to treat the liver disease in mice. And also, I can't highlight enough that how our science is a result of continuous collaborative effort. And with our close colleague at the CREAM with Dr. Wilson, Kazaman, Cotton, and Holtz, and also on the Charles River campus, Dr. Vegas and Dr. Waxman. Our success also rely on all the core facility and also services that are provided by the CREAM, BU, and BMC. And I think I'm out of time. So I just wanted to let you know. So we just had a patent and we are collaborating now with this company, Cytoterex, that will actually license this patent and to test all our mRNA LNP target in pigs. This will be a step forward clinical translation of our work. We collaborate with companies that provide us with LNP, Acuitas, and Gouon-Evans. And as I told you, the mRNA LNP are provided by Drew Weissman, Norbert Bardi, and we also collaborate with other investigators. And of course, I thank all our funding, and especially the CTSI provided us with a pilot grant and training grant for students, and Alpha One Foundation, BMC Pilot Project, and BU Initial Award and NIH. Thank you. Question, please.
Hi, Valerie. I have a question. Thank you for an inspiring talk and congratulations on your awards. Can you comment on the role of perfusion in fibrotic liver injury, and is your VEGF mRNA LNP delivery also sort of a result of increasing the vascularity of those lesions and increasing blood delivery to the fibrotic areas, or is it literally just cholangio to hepatocyte conversion?
Yeah, so this is a very good question. We still don't know, actually. So what we can see in mice, it's really the cell conversion between cholangiocyte and hepatocyte. But obviously, we are also targeting the endothelial cells in the liver. We see the vessels are more dilated, so it's vasodilated. So it's obviously we are reaching them also. We are right now analyzing some single nuclei RNA-seq data to understand what we are doing with this VEGF-A treatment, that could, what is the mechanism to reduce fibrosis and steatosis? I mean, yeah, so this is something we are looking for. So
Thank you.
thank you.
Hi, so I was taking a look at the biodistribution in the liver and it looked incredibly clean. So I'm very curious if you could let us know what the, ionic or cationic, lipids or helper lipids and what the particular ratios were.
Right. So I won't be able to answer to this question. We get the LNP from those were from Acuitas. And right now, we have this collaboration with Gouon-Evans, and I'm discovering with them, how they use this different ratio and how it's important indeed to target specifically some different cell type in the liver. So unfortunately, I don't have these details, but yeah, it's an amazing field actually that can target different cell type if we change the lipid or yeah. So it's sorry I can't answer.
One quick question. I'm a clinician. And the question I care about eventually is when can you create the liver that I can put into my patient? So you convert cells using these cocktails. Do we really know that the cell that pops out on the other end of that, it looks like a hepatocyte or whatever we think we've differentiated into, but is it really that? And does it really operate like a cell? Can we be confident we can put it back in and it'll operate like a liver cell?
Mm-hmm. Yeah, absolutely. So, I mean, some studies, there are many groups now that are looking at this cell conversion and how functional the cells are. So, and they have been doing some comparison between the tomato positive hepatocyte versus tomato negative. So, and they found, so by the time they look at it, it was the metabolic activity of both cell type was quite similar, but this is something again we are going to verify in our single nuclear RNA-seq.